Welcome to the Health and Wellness Show. This is Paul Hambleton. Today we're going to be talking about headaches, stress, and the relationships with the temporomandibular joint. We're going to do this from the perspective of a chiropractor. Today we have Dr. John Cartile with us. Welcome to the show.
Hi, thanks.
I'm glad you could join us today. Before we get started on some of the issues I just mentioned, I was wondering if you could just tell us a little bit about your area of expertise.
Sure. Well, as a chiropractor, one of the big things we're after is a nice, healthy nervous system. The nervous system is what connects everything in our body to our brain. So we need that itself to be functioning really well, to have everything, our brain really understand how our body's working. So obviously, as a chiropractor itself, we always get pegged as back doctors, and this is a lot has to do with the spine and the spinal cord itself. So as that spinal cord runs down that spine, we make sure that that spine isn't one of those factors that is interfering with that underlying nervous system and creating those problems.
Terrific. So could you tell me a little bit about how you got started in your field then?
Yeah, well, as a local Toronto boy, obviously played a lot of ice hockey as a kid, and when I was a teenager, I fractured my spine playing. So I had a compression fracture through the middle of my back itself, and we had a good family friend who was she was a chiropractor itself, and so my parents took me in to go see her, and yeah, she did a great job of getting me back on track and making sure that everything itself really progressed well, and kept me pain free and kept me playing ice hockey as well, which was more important, I guess, when I was a teenager. So
I find that with a lot of people in the health profession, and that they've had a personal experience that's helped them a lot, and they end up being drawn towards that field. So it sounds like you were helped really well, and you're a real advocate and student for what the profession can do for people.
Yeah, she, just the whole experience of going in and seeing her and listening to her philosophy about sort of, really optimizing health was, even at 14, it really did open my eyes a little bit about just, status quo just wasn't enough, about really striving for excellence in essence. So
That's a great story. So how long have you been active in your field? I mean, I imagine there's been a lot of education that's been required to get to the point where you're at now.
Yeah, this is my 8th year of practice, and I've done 7 years of university. So I did an undergrad degree at the University of Western Ontario. That was in the Bachelor's of Health Science, and then I had the opportunity to go to Macquarie University in Sydney, Australia, and that's where I did my Master's of Chiropractic degree. So that was a 4-year degree down there in the sunshine and the nice weather. So it was a great sort of experience, both studying itself and also just in life. So it was
Sure.
yeah.
Great. Sounds like you're well traveled then.
I've been working on it. Yeah, I've actually just recently moved back to Toronto after I graduated from the chiropractic college itself. I actually went across to the UK, so I practiced in Scotland and in England for the last 7 years. So relatively new back in the cold Canadian winters again. So, but yeah, enjoying it.
But Toronto's your home now.
It is, yes.
So what type of services do you provide then at your clinic?
Well, at the clinic itself, it's a naturopathic clinic, so we have quite a few practitioners here. But for me, as a chiropractor, our treatments are called adjustments. So these are where we do alignments through the vertebrae itself or through extremity joints if need be, to really, as we talked about, to relieve that tension itself and take the pressure off any irritation on the underlying nerves in that nervous system. So the techniques I use themselves, they can be either soft and more muscular in release itself, or we can do a little bit more of a manual adjustment itself where we're shifting those bones with a little bit more pressure and specific line of drive. So
I guess it depends on what the severity of the condition is, as well as the state of the health of the patient, as well as their tolerance for different types of treatments, and all of that probably gets factored in with an individualized approach.
Exactly, yeah. There's 7 billion people in the world, and we're all different. So what works for one might not be the best course of action for someone else. So it's nice to have quite a few tools in your tool bag to make sure that you can, tailor the treatment specifically to each person that comes in. So.
And I imagine it varies from the different types of symptoms that you see. So what are some of the different common symptoms that you see with your patients?
Yeah, well, primarily we see a lot of low back, neck pain, and headaches. Those are some of the big things, and quite common with most people. Unfortunately, we suffer those more than we really should. So these are the big things that really bring people through the door. But I have a special interest in a lot of pregnancy and a lot of kids as well. So with them themselves, an infant and a toddler, they're not really telling you that they have a headache or low back pain, but a lot of that is making sure that the birthing process and everything through there has been okay on their body, and that spinal system, again, that spinal nervous system itself is functioning well. So.
Mm-hmm. Well, headaches is an area I'd like to talk a little bit about. Can you tell us a bit about the different types of headaches that a person might experience that you see in your practice?
Sure. Well, obviously, some of the more common ones are your migraines and cluster headaches, and tension headaches as well, which is one of the main ones that I have quite good success in treating. The tension headaches these are the ones where there's a buildup of pressure in through, with gravity being a force that's always working on us. We use our muscles and our skeletal system to support us against that. And, when we're in an awkward position or posture, or we have a lot of stress on our body, it causes these muscles themselves to tighten up. And this is where a lot of these tension headaches originate and start from. So that's a big thing that we really, quite successful with. When it comes to migraines and cluster headaches, usually there's a lot of factors that contribute into that. So, when we deal with patients like that, usually they best get results from multiple practitioners addressing multiple concerns with them, whether it's diet or the triggering factors itself that can start these off, while at the same time we reduce some of the muscular tension that's through there, and as I say, really work on that nervous system to make sure that that's not a factor to these migraines and cluster headaches as well.
Mm-hmm. So you've talked about the alignment of the spine and headaches or migraines. So how can the misalignment of the spine in particular play a role in headaches or migraines?
Sure. Well, as I say, unfortunately, it's sort of a victim of the modern time now, with a lot of people doing their jobs when they're at a desk or in front of a computer. So that posture that really sits in there, that force of gravity pushing down on us, if we get out of that alignment itself and we hold our body into a different position, that really increases the stress and strain on the muscles. And our muscles they're designed to move us and not really hold us. Prime example is I get people to hold their arm out to the side of their body for 10 minutes. They just can't do that. Their arm gets very heavy and very tired. So,
yeah, that's a long time to hold your arm out, even a minute or two, right? So your muscles aren't designed to do that, but with your head, that's a different story.
Well, yeah. With the head, again, it's the head is not. We don't hold it out as far as our arm, so our body can cope with it a lot better. But the same mechanism is occurring, and for most people, when they're doing their 9-hour workday, 9-hour workday, that really adds up day in, day out as the weeks go on. So as these muscles get tighter and as these problems start to become more and more ingrained in that body, that's usually when we see the increase in frequency of headaches as well occur with it.
So we've talked about headaches, and I'd like to move into talking about the TMJ, temporomandibular joint, and what the relationship is between the TMJ and the head and the shoulder and the neck and the spine, and how all that's interconnected and interrelated.
Sure. Well, the TMJ is it's quite a unique joint in that sense, in that it doesn't have gravity is actually opening that joint as opposed to compressing it, where every other joint in our body, majority of our other joints are, we have that compressive force that's there. So the same thing sort of transpires is, we want that jaw to track straight up and straight down. So when we do close that jaw together, both sides of the teeth are coming together at the same time. If we start to have one side hit than the other, then we get this torquing and twisting mechanism that can occur. And this does a few things to some of the cranial bones in through that skull as well. And as we start to torque and twist those cranial bones, again, we start to get changes in the tension and tone through both the soft tissues that are there, and also we start to get irritation in through there, which creates a lot of these headaches. So the jaw itself is very, very commonly missed by a lot of chiropractors, unfortunately, because they really just focus on a lot of the skeletal system itself, and they tend to forget about that jaw, unfortunately. But it is a very common and very important part to really not just having a neck and spine function well, but also to having the person be able to keep and maintain that correction as well.
Mm-hmm. You do some work with people who have been in an auto injury or workplace injury, and does that affect, can that be a cause, in your opinion, of temporomandibular joint disorders?
Definitely, definitely. If you think about evolutionary terms, when our body's been designed, we were never really supposed to be in steel vehicles going at that speed and having that sort of impact of force go through our body. And obviously whiplash in the neck is very common for a lot of people, know about this itself. We have a very heavy head, very small neck. So when that momentum gets going of the heavy cranium, it does create a lot of injury to those spinal segments. But that jaw, in the same sense, it can get tossed and thrown around too with the quick motion of the whiplash and the contact. And this is where a lot of times these areas themselves really the problems originate from, even though they might not start to get symptoms from years down the track. So I see it quite commonly with a lot of people. The whiplash generally gets treated quite well by physios and chiropractors and medical doctors itself, but the jaw gets obviously overlooked, and years down the track, this is when some of these dysfunctions and areas and problems start to come back again.
So it might happen, they may have a problem with the TMJ years after they had an injury of some sort.
Definitely, yeah.
Yeah. So what about stress then? So we've talked about headaches in the neck and the TMJ, and I imagine stress plays a role in these symptoms.
Sure. Obviously anytime, I'm sure most people will notice that they find themselves when they're really stressed at the time, they physically have to consciously think to relax their shoulders, So mental stress does create physical symptoms in the body. And as we talked about earlier with the posture, especially when we're at computers and desks and such, the stress and the physical response is also loading on those same tissues that we're asking a lot of when we have these awkward positions and postures that we hold through our regular day. So it's it's one of those things themselves is, if we don't address that underlying stress itself, then it's really trying to push water uphill when we're trying to do some structural change with the person. So that stress really needs to be addressed to not just get rid of the symptoms, but to really make the change in the patient so these problems don't come back.
Mm-hmm. So what with the head and the shoulder, the neck, the spine, the temporomandibular joint, and even stress, what would some of your treatment approaches be for people who have one or more of those conditions?
Yeah, well, I with most patients themselves, when they come in, obviously pain is the usual motivating factor. So the big thing we need to do is we need to start to restore the biomechanics that are dysfunctioning there. And as we start to restore those biomechanics, it allows the tissue in there to improve and heal, and that's when that inflammation really starts to subside. And that inflammation is a big thing that creates a lot of the pain and problems with patients. So generally over the next couple months, when those tissues themselves improve, that's when they really feel like everything's really getting back on track. And then obviously the big thing is we start to re-educate them on some of the things that have created these sort of behaviors and problems that has caused these tissues to break down. And that's really where we get the long-term change in somebody. We're creatures of habit. We have a tendency to do the same things over and over again until there's an external source or something that tells us to do something else otherwise. Prime example is I get people to cross their arms, and then I ask them to cross them the other way. And it's quite interesting when I do health talks is you'll find that half the people, they'll sit there and just spin their arms in a circle and put them back the same way that they started with. And the other people will kind of do it, and then they'll kind of look at, and they have this really odd face as they go, this is feeling quite awkward. And, we do this out of repetition of motor patterns, and it's a lot of times these repetitions that really lead to breakdowns. So whether it's your sleeping position or lifting habits or your sitting position, simple things like crossing your legs the same way all the time, carrying your bag a certain way, even simple things like diet and your eating habits as well. So these are all things that can really have a profound effect on our health and well-being.
So when somebody comes in, one of the things that you do, I imagine you have a discussion and then an assessment with them to uncover some of these issues that could potentially be causing the problem, so that you're trying to get to the root cause of the problem in the first place.
Definitely, yeah. We do a full history with them and really get, even going back to their childhood when they've had slips and falls or injuries like that, because that's a lot of times where things can originate from. And then, the physical assessment, what we want to do is we want to assess and see how each of those joints and tissues themselves are really holding up with everything. So, and then obviously, we discuss sort of the treatment plan and give them a good roadmap on how we're going to treat it, how long it's going to take, and ultimately, how far, what we can do in order to get them to the point that they want to be.
Mm-hmm. And a series of adjustments, is that the main process that you're using for treatment over a period of time?
That's the main treatment that I would use itself. The adjustments themselves, and each one builds on the adjustments that we've done previous. So in essence, we're retraining the tissues and the specific segments to sit in a better position.
And it takes a little while for that to happen. It doesn't happen overnight, because they've been doing things the wrong way or working with a dysfunction for a long time, so it's trying to correct that structural imbalance, and you're taking an approach where it's being improved consistently over a period of time.
Exactly, yeah. It's when I treat kids, they generally respond in a few adjustments, because they don't have that chronicity of these problems that are there. Plus, they're not, putting their body through the same daily grind that we as adults do. So as adults, it is sort of every treatment is 2 steps forward, but generally there's always a step back from the people because of what they're doing on their daily grind, until that really starts to become those behaviors really start to change, and that's really where you make the 2 steps forward, and then it's just adds and adds and adds.
And again, every patient is different based on their current state of health and based on their age, so you're going to treat everybody based on their particular condition, and some people would need to require more treatment and other people less, and it all depends on where they're at right now, and it's a customized approach, it sounds like.
Exactly, yeah, exactly.
So now, taking this further, ultimately you want to, as a first step, get people out of pain or whatever their particular issue is that they came in for. Now, how can this lead, your treatment approaches, how can this lead to long-term wellness that everybody's looking for, and I imagine you have as a goal for your patients?
Sure. Well, as I say, the big thing with wellness is really starting to initiate good, healthy behaviors, whether it's diet, whether it's activity, whether it's your posture, and reducing the things that are detrimental to us. And so the more good things that we're doing and the less bad things that we're doing itself is really where you get that true wellness. And so as we talked about, with that nervous system being so integral to having proper function of every aspect of our body, it's very important that itself is clear of any interference. So that way, when you are out, you are doing the exercise, or you are eating the good, healthy food, you're getting the maximum benefit of it, and you're not just perhaps progressively just doing the same thing again and again and causing detriment because something's not functioning well and it's not being able to cope with, your 20-minute run or, this, that, or the other. So when it comes to the wellness itself, we really want to make sure that nervous system is A1 and healthy. That's the key.
Would you have a couple of tips, some important tips, 2 or 3 of them, for people who are looking to understand more about headaches from your perspective, from a chiropractic perspective?
Well, when it comes to headaches, I mean, the first thing to understand is they're not normal. If you have the occasional headache, either from a night out or you have dehydration or stress itself, then that is understandable. That can be part of that coping mechanism that's there. But if this is a regular occurrence with you, then there really is something that's not right with the body, and either it's something that you're doing and you're overloading it too much, or there's not enough protection in that body to be able to cope with it, and that's where that breakdown is occurring. So if some of this itself is occurring with you itself, then you need to get someone to have it checked out. A good analogy I like to say is, if you're driving and your engine light comes on in your car, you just don't go put a piece of black tape over that engine light. You pull over and you try to find out why that engine light came on. And if you can't assess it, then you at least go bring it to someone with some expertise to really find the root cause of it, and that's very important. It's I see it a lot with people itself. With headaches, they tend to marginalize it and make it seem as if it's no big deal, and they just fall into the trap of commonly popping painkillers, which is a slippery slope to go down. And it's one of those things. Now they've actually they now have a diagnosis for rebound headaches, which is exactly that point of coming out of the withdrawal of these painkillers as a regular sort of occurrence. So you end up increasing your frequency of the headaches once you sort of get into that vicious cycle. And as we talk about with wellness, that's really one of those detrimental behaviors that we really want to avoid if we can.
So with headaches, once again, it's like the engine light in your car going on. It's a red flag that people should at least get it checked out to see what the source of the problem is, and a lack of painkillers is not what the problem is.
Exactly.
So that's just asking the problem.
Exactly. Yeah. We're not deficient in acetaminophen or
Right.
ibuprofen or any of the the painkillers and anti-inflammatories out there. That's not the issue. So.
Right. So a chiropractor is obviously a great step. If someone were looking to visit a chiropractor, what should they look for?
Well, all chiropractors in Ontario, we're all registered with the College of Chiropractors of Ontario. So there's a website, www.cco.on.ca. So, most chiropractors themselves will all be on that register itself. So, if you're going to find one itself, they need to be registered. So, we use many different techniques as chiropractors. So, it's important as well that, your experience with one chiropractor might not be the same if you see someone different. So, when finding a chiropractor itself, obviously find some information about the techniques and how they treat itself. And if it really resonates with you and how you think this is really going to go well for you, then they're definitely someone that you should give a ring and have them check you out. So, as I say, the technique I use is sacral occipital technique, which is it's something I came into midway through my career itself, and because it really did help me assess a lot more of the physical, chemical, and the emotional components of these underlying issues, where the other technique I used to use was very much on that physical side of things. So it really opened up a lot of doors, and for things like headaches, it has made a massive difference to my practice and being able to, as you say, really assess each individual specific person with that individual specific cause. So
if listeners were looking to get in contact with you, what's the best way that they can do that?
Yeah, we have a great website, www.innatewellness.ca, and also, the clinic itself, we're on 5 Quebec Avenue at High Park in Toronto, and so the website is one of the best ways to go through it, and we have a little bio on there, and they have all the details about getting in contact with us at the practice if you want to come in and have a chat. Yeah, that's the easiest way to do it.
So now the spelling of Innate Wellness, that has 2 N's. Could you spell that out just so people are clear of what the website address is?
Yeah, no problem. It's INNATEWELLNESS.ca.
Okay, terrific. Dr. Cartile, I'd like to thank you very much for your time today and sharing all your expertise based on all of your extensive experience. We really appreciate it. Thank you very much.
Thank you very much.
Okay, bye-bye.
Bye-bye.